You're not crazy, you're postpartum, and there's a real difference. I'm Mandy Stryke. I'm a family nurse practitioner, mom of two littles, and postpartum nutrition specialist. And this is Postpartum Real Talk, the show where we stop the sugarcoating and give you clinical clarity and the honest conversation you actually deserve. Let's get into it. You're not crazy, you're postpartum, and there is a difference. And I want to say it again slowly because I think a lot of you need to hear it more than once. You're not crazy, you're not weak, you're not failing at motherhood, you're not ungrateful, and you are not broken. You are postpartum, and postpartum is a medical state, not a mindset problem. Today's episode is one that I wish I could hand to every single postpartum mom sitting in a waiting room or staring at the ceiling at 3 a.m. or smiling and saying, I'm fine when someone asks how she's doing, even though she's anything but fine. I know who's listening right now. You're the mom who's told your blood work looks normal or your baby is healthy, everything looks great, but you feel like you're drowning and you cannot figure out why. You're the mom who cried in your car on the way home from your 6-week visit because your provider had 12 minutes for you and none of them addressed what's actually going on. You're the mom who Googled, is it normal to feel this way after having a baby at 2 a.m. and fell down a rabbit hole that left you more scared than when you started. This episode is for you. And by the end of it, I want you to have something I think every postpartum mom deserves, but very few actually receive: a clinical explanation for what's happening to your body and full permission to stop pretending you're okay when you're not. Let's make the clinical case for why you are not crazy, because I think when you understand what is actually happening to your body, then it becomes almost impossible to keep blaming yourself for how you feel. So let's start with hormones because this is where it all begins. During pregnancy, your estrogen and progesterone levels are elevated dramatically. We're talking at levels that are exponentially higher than your baseline. These hormones support the pregnancy, support your mood, support your cognitive function. They keep you relatively stable through the 40 weeks of growing another human being. And then you deliver, and within 24 hours of birth, your estrogen and progesterone drop by approximately 100-fold. 100-fold in 24 hours. To put that in context, that hormonal shift happens to your body in the first day after birth is the most dramatic hormonal event a human body ever experiences. More dramatic than puberty, more dramatic than menopause. It happens faster and harder than anything else your endocrine system will ever go through. And we hand women a pamphlet at 6-week follow-up appointment and call that postpartum care. So if you're feeling like your emotions are completely dysregulated, if you're crying one minute and laughing the next and then numb the next, that is not a character flaw. That is not anything but direct expected neurological consequence of the most extreme hormonal shift your body has ever undergone. Now let's talk about sleep, because I want to reframe what sleep deprivation actually is clinically, because I don't think most people understand how serious it is. Sleep deprivation is not just being tired. Research shows that being awake for 17 to 19 consecutive hours impairs cognitive function to a degree comparable to a blood alcohol level of 0.05%. At 24 hours without sleep, the impairment is equivalent to a blood alcohol level of 0.1%, which is above the legal limit to drive in every single state. You are operating in the early postpartum period at a level of cognitive impairment that we would not legally allow someone to drive a car with. And we are expecting you to keep a human being alive, regulate your emotions, make decisions, maintain relationships, and feel grateful for all of it. This is not a you problem. This is a systems problem. And understanding that your brain is genuinely impaired by sleep deprivation, not weak, not dramatic, but genuinely impaired, should change how you talk to yourself about how you're functioning. Let's talk about what is happening neurologically. Oxytocin, your bonding hormone, surges postpartum. Prolactin, your milk-producing hormone, surges postpartum. Cortisol, your stress hormone, surges postpartum in response to physical demands of recovery and the psychological demands of keeping a newborn alive. These hormones are all interacting simultaneously. They affect your mood, your cognition, your anxiety levels, your ability to feel pleasure, your ability to feel calm, and they are not static. They are fluctuating, sometimes dramatically, sometimes hour to hour. The emotional dysregulation you are experiencing, the anxiety that feels like it's coming from nowhere, the rage that shocks you, the numbness that scares you, these are not signs that something is wrong with who you are. They are expected output of a brain and body navigating an unprecedented hormonal landscape of no sleep while also performing the most demanding job that exists. And then there's physical recovery piece, which I think gets completely ignored postpartum. You just went through a major medical event, sometimes major abdominal surgery. Whether you had a vaginal delivery or a cesarean, your body just did something enormous. Vaginal birth involves the stretching and potential tearing of tissue, the displacement of organs, and the extraordinary physical effect of labor. Cesarean birth is major abdominal surgery involving cutting through 7 full layers of tissue. And we give women 6 weeks and call them cleared. Nobody who had major surgery, whether it's a hip replacement, an appendectomy, open heart surgery, is told that they're cleared at 6 weeks and sent back to full function. Nobody. We would never apply that standard to any other surgical patient, but we apply it to postpartum women every single day. Your body is recovering from something significant. The fatigue you feel is not laziness. The pain is not weakness. That feeling that your body doesn't belong to you anymore is not dramatic. It is the reality of healing from a major physical event while simultaneously sustaining another human life. And one more thing I want to address, because I hear it all the time and it makes me so frustrated on behalf of every postpartum mom who's ever had it said to her. You should just be grateful. Other people have it worse. At least your baby is healthy. And I want to say this as clearly as I know how to say it. Your suffering is not canceled out by gratitude. Both things can be true simultaneously. You can be deeply grateful for your baby and also be genuinely struggling. You can love your child more than anything and also be drowning. Gratitude and struggle are not mutually exclusive, and anyone who applies that has never sat with a postpartum mom who is doing everything she can. You are allowed to need support even when things feel fine. You are allowed to not be okay even when your baby is healthy, and you are allowed to struggle even when you wanted this. So here's your permission slip. Read it, save it, write it on a sticky note if you need to. You are allowed to struggle and love your baby at the same time. These two things are not in conflict. Postpartum struggle is not whether you love your child or not. It is not evidence that you made a mistake. It is not proof that you're not cut out for this. It is the reality of what your body and brain are going through, and it deserves to be treated as such. You are allowed to feel overwhelmed without it meaning something is fundamentally wrong with you. Overwhelm is the appropriate response to an overwhelming situation. A newborn who needs you constantly, a body that is healing, a sleep debt that is compounding daily, a relationship that is adjusting, an identity that is shifting. Overwhelm is not weakness in the face of reality. It is a reasonable human response. And you are allowed to ask for help. You are not just allowed. I'm telling you that as a clinician, asking for help is how you're going to survive. It's the most evidence-based thing you can do right now. We know that social support is one of the most significant protective factors against postpartum depression. We know that isolation worsens postpartum outcomes across the board. We know the I've got it handled posture that so many moms adapt to is actively working against the recovery. Asking for help is not admitting failure. It is not practicing medicine on yourself. It is doing the thing that research says will heal faster and feel better sooner. The rage you feel, the disproportionate fury at the pile of dishes, at the partner who slept through a feeding, at the well-meaning family member who said the wrong thing. The rage is a symptom, and it's not who you are. The tears that come out of nowhere, those are a symptom, not weakness. The anxiety that hums underneath everything, that has you checking the baby monitor 17 times, that is a symptom, not you being dramatic. The numbness, the disconnection, the flatness, those are symptoms, not proof that you are broken. Symptoms are things that happen to you. They're information about what your body and brain need. They are not character judgments. They're not permanent. And I want to say something about the moms who are experiencing symptoms that go beyond what I've described. the moms who are having thoughts of harming themselves or their baby, the moms who feel completely disconnected from reality, the moms who cannot function at all. Postpartum depression, postpartum anxiety, postpartum OCD, postpartum psychosis. These are real, recognized, diagnosable, and highly treatable conditions. They are not shameful. They are not evidence of failure. They are medical conditions that happen to occur in the postpartum period, and they can respond to treatment. If that's where you are at right now, please tell someone today, right now. Your OB, your midwife, your primary care provider, a therapist, a crisis line, tell someone. You do not have to white knuckle your way through this alone. Help exists, it's worth it, it works, and you deserve it. Okay, I don't want to leave you only with validation. As important as that is, I want to give you something concrete to do with it. Here's what I want you to do after this episode. First, name what you're feeling, not to anyone else necessarily, just yourself. Get specific, not I feel bad. What does bad mean? Are you anxious? Are you sad? Are you angry? Are you numb? Are you terrified? Are you exhausted beyond what you thought was possible? Naming your emotional state has a documented neurological effect. It activates the prefrontal cortex and reduces the amygdala reactivity. In plain language, naming what you're feeling literally claims it and calms your nervous system. It's not just a therapy cliche, it's neuroscience. Say the words, even just in your own head. Second, tell one person the truth about how you're doing. Not the I'm tired, but we're good answer, the real answer. One person, your partner, your best friend, your mom, your sister, your doctor. One honest conversation. I know how hard that is. I know the reflex is to protect everyone around you from worrying. I know the fear that saying it out loud makes it more real. But silence is one of the things that makes postpartum suffering worse. And connection is one of the things that makes it better. One honest conversation. That's the ask. Third, know that this has a timeline. Postpartum is not forever. I want you to really hear that. The hormone levels that crashed will regulate. The sleep deprivation eventually will improve. The identity shift will settle into something that feels more like you, a changed you, but still you. And that acute intensity of the early postpartum period does not last indefinitely. This is not your permanent normal. This is a season, a hard, significant, real season, but that's it, just a season. And fourth, if your symptoms are severe, if you are not functioning, if you are having thoughts of harming yourself or your baby, if you feel completely detached from reality, please, please, please reach out to your provider today. Not what next week, today. Postpartum mood disorders are the most common complication of childbirth, affecting 1 in 5 women, and they are among the most treatable conditions in psychiatry. Early intervention makes an enormous difference. You are not too far gone. Help works. You came into this episode maybe wondering if you're crazy. I hope you're leaving knowing that you are not. You're postpartum, and there is a difference, a real, clinical, measurable, documented difference between what is happening in your body, in your brain right now, and what you feel on the other side of the season. You are not crazy. You are navigating the most hormonally extreme, physically demanding, identity altering, sleep deprived period of your life while keeping another human being alive. The fact that you are struggling is not evidence of a failure. It is evidence of how much you are carrying, and you deserve support that matches what you're actually going through. That's what this show is here to give you. Every week, we're going to be in this together. The clinical truth, the honest conversation, the validation that I think every postpartum mom deserves, and so few actually receive. If this episode helped you, if it made you feel less alone, more understood, a little more like yourself, will you share it? Send it to the mom in your life who is always white knuckling her way through the newborn phase. Text it to the friend who keeps saying she's fine. Share it on your stories because the mom who needs to hear this might not find it on her own, but she might find it through you. Thank you for being here. This podcast exists because of you, and I'm so glad you found it. I'll see you next week. Take care of yourselves.